You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV. I'm your host, John Tassoni. This is the Voice of Hope. My guest today is Jonathan Goyer. And Jonathan Goyer is going to tell you a story that is incredible in the life of Jonathan Goyer. Jonathan, welcome.
Thank you for joining us
Thanks
today. For having me.
So tell me about, and my viewers, about your story, because it is an amazing story.
Where do I begin?
Where do you begin? You begin at the top, my friend.
Work my way down. Well, my name's Jonathan Goyer. I'm a person in long-term recovery. For me, that means I haven't consumed any substances or alcohol for over 8 years now, since June 17th of 2013.
Congratulations.
Thank you.
Tell me how you got there.
How did I get there? A long road, right? A long road. I had struggled since I was young. Experimenting with different substances, and ultimately it took me down a path where I became homeless, jobless, really just a burden on society as a whole, right? And I didn't wake up one morning thinking, oh, I'd like to be addicted to drugs one day. It just sort of happened. Very slowly, all of my ambitions in life sort of dwindled. And I just found myself really living for the next high, right, from that drugs gave to me. And it was a long road to recovery, a lot of in and outs. I went to, people often ask me, right, oh, how did you get there? Well, treatment was one step of the process, different levels of treatment. And when somebody asks me, how many times does it take for somebody to get it, right? The only answer I have from you from my personal experience is 37 inpatient treatment admissions before I was able to finally really secure long-term recovery.
So we've been friends for a while.
Yes, we have.
Tell me about your experiences with the substances that you used, and tell my viewers how many times you've been saved. And then I also want you to tell my viewers about your incarceration.
Sure, absolutely. So substances really varied. My drug of choice was really whatever you had, whatever was in front of me at the time. Ultimately, I really settled on opioids, being addicted to prescription pain medication all the way up to illicit heroin. Which I really, unfortunately, became chemically dependent on, right, where I was experiencing withdrawal symptoms if I did not have it. That went on for many, many years. And of course, naturally, with the lifestyle of that came being incarcerated. I've been arrested 4 different times in my life. Currently have a criminal record of about 17 different charges, from felonies and misdemeanors, in and out of the judicial system. And it didn't seem to stop me, right, from continuing to go on my rampages, right? There was something wrong with me that I had to address.
And what about your friends? What about your family?
So friends in my active addiction, although I had some people that I associated with, I was really became much of a loner. Right, where I used alone, and I wasn't that enjoyable to be around anyway, so that's understandable. In terms of family, I do have a very supportive family in my life today, but during my active addiction, they had to take care of themselves, and at times had to really exercise maybe tough love, as some people call it, or setting boundaries with me, right? Because when we talk about addiction impacting somebody, of course it impacts the person that is using them, right? It puts them at risk for an overdose, oftentimes, again, becoming homeless or unemployable. But it also impacts everybody around that individual. And more times than not, that ends up being the family that's impacted. where my drug addiction and my bad choices were negatively impacting the quality of life of my family members. So there were times where they had to step back, which was healthy for them and really allowed them to be well positioned to help me once I got into recovery.
So the question that people are probably asking at home is that you're sitting in this chair in the studio telling everyone your story. Why?
Because my story is one of many, right? It's one of many. There is a lot of stigma around addiction, around mental health issues, and I don't like using that word. I think stigma in and of itself perpetuates more stigma, but negative public perceptions or negative public attitudes is oftentimes the biggest barrier for somebody to getting help for their addiction or their mental health crisis. And one of my favorite taglines is, "We can't face it if we can't fix it." Right? So I'm here today facing it, right? Not ashamed of who I am today, proud of who I am, proud of what I've been able to accomplish in recovery, and really here to tell anybody that if anybody's struggling or they feel like they've gone down too far, they've made too many bad decisions that they can't turn their lives around from, too much damage, too much wreckage to face and overcome, that's simply not true. That's a lie that we tell ourselves when we're sick, right? So I'm here to tell you and all of your viewers that that recovery is possible. It's not only possible, but it's probable for anybody wishing to really get better.
So when you were using needle-wise? Were you using nostril-wise? How were you using?
Needle-wise, you should coin that. I've never heard that term. I like that. I consumed substances on every level, whether it was smoking, inhalation, snorting, consuming pills, and ultimately became an IV drug user. And as a result of that, actually contracted hepatitis C.
Really?
Through sharing needles with other individuals that were infected at the time. And it's interesting because we have programs here in Rhode Island, like the Needle Exchange Program, which has incredible success rate in terms of reducing HIV and HCV, hepatitis C, transmission. But unfortunately, you do have individuals like myself at the time of my active addiction that really didn't care, right?
Right.
They're not able to really fundamentally understand the damage and risk that they're putting themselves in at any time. So, and I did. Every day I put myself at risk. And, I say in my 10 years or so of active addiction, I wasn't living, I was dying, right? I was merely existing. I had accepted the fact that addiction was going to take my life, and it was really just a waiting game of when, where, and how that was going to happen.
Right. Now, how was that going through your head? Was that going through your head every day? Could this be the last time? Could this be the last time that I used? Absolutely.
It absolutely was, and again, it's you just grow to accept it, right? To just accept the fact that day is going to come, and with that, it's really hard to build a foundation of hope with that, and that's what I also hope to bring to our show here today is hope for those who need it most.
I got to tell you, Jonathan, for someone, and we'll get back to this on the second phase of the show, but you haven't told my listeners what I want you to tell them, and we're going to talk about that when we come back. You're listening to Recovery TV. I'm your host, John Tassoni, the voice of hope, and we'll be right back after this.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. By quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
The The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Welcome back to Recovery TV. I'm your host, John Tassoni, the voice of hope. My guest today is Jonathan Goyer, and Jonathan Goyer has a story of all stories. So Jonathan, thank you for joining me today, and thank you for sitting here today and telling your story to my viewers, because I think for them to see someone who has gone through what you've gone through, and we haven't even touched the iceberg yet, which we will at this segment, it brings hope to know that there is hope in recovery. What's your thought on Narcan?
Narcan. So Narcan, for those of you who do not know, is a medication prescribed to reduce the impacts of an opioid overdose. And I've grown to love it. Narcan saved my life back in 2013. I'd experienced many overdoses in my active addiction, opioid overdoses. I'm not even sure I can give you an exact number of how many times, but my final was June 16th, 2013, and I was saved by Narcan, which was delivered to me or administered to me from somebody who had passed by and found my lifeless body and called 911, administered Narcan to me. When the ambulance showed up, they administered more Narcan to me. And I haven't, from that day, I was able to, again, start my journey of long-term recovery. It's a needed medication because it saves lives, right? In 2020, last year in Rhode Island, we lost 384 lives due to drug overdose. So had people had Narcan present at the time of those overdoses, perhaps some of those lives could have been saved.
Narcan. Now we got a shortage.
Yeah.
Because we've had so many overdoses, and I mean, there's a shortage for other reasons, but with this shortage, do you see the overdoses spiking?
So when you compare 2019 to 2020, we've seen a 25% increase in fatal drug overdose deaths here in Rhode Island. Nationally, it's closer to about 33%, so I hate to call that a win, but Rhode Island is doing better than other regions throughout the country. Unfortunately, in 2021, we're already seeing a 15% increase in fatal drug overdose deaths. And Narcan is one tool that's really sort of a common sense tool that everybody should have it, everybody should know how to use it, everybody should know where and how to locate it, and it should be available to everybody.
You know, one of the things too that I think Rhode Island does a great job with, which is the Governor's Overdose Task Force, which you and I are both members. Talk a little bit about the Governor's Overdose Task Force.
The task force began about 6 years ago now, maybe a little bit more than 6 years ago. It's comprised of about 50 members that range from people in the community, recovery community, first responders, police, law enforcement, treatment, healthcare professionals, faith-based community, a whole sort of multidisciplinary approach to this, and it's very well attended. It meets monthly, second Wednesday of every month at 11 a.m. They're doing a hybrid model now of Zoom and in person. And we have about 200 people that attend it every month. It's really the sort of the pinnacle event of every month for everybody that's doing this work in terms of overdose prevention, increasing access to recovery support and treatment support, and it's really reliant on the community showing up and participating, because some of the best change that we've seen happen in terms of the treatment and recovery landscape in Rhode Island has been a result of individuals going to this meeting and voicing their concerns and participating in this task force and letting our state leaders know what's needed, right? Because as time goes on, as COVID-19 impacted the epidemic last year and exacerbated a lot of the problems, we need to pivot, right? We need to be flexible. We need to adapt to the needs of the community. And it's hard to understand what the needs of the community fully are if individuals aren't showing up to that meeting, which is a public meeting, and voicing their concern.
Yeah, it's about people who have boots on the ground, who come up with these ideas. Not every idea works. It's a group of very talented individuals.
It is, and Rhode Island has been one of the more innovative states in the country. Absolutely, right. In terms of implementing new programs, utilizing peer recovery support specialists in the emergency rooms, Safe Stations, which is a program in Providence. Anybody can walk into any fire station in the city of Providence 24/7, ring the bell and ask for help. Within 15 minutes, they'll have people with lived experience show up in front of them and talk about what some options are for help that meet that individual's needs. Just some incredibly innovative programs going on.
So let me ask you one thing, Jonathan. I mean, obviously that, you know, with your experience in the field, your lived experience, do people who are in treatment, do they look up to you as someone who has lived it, experienced it, and as of this point today, have gotten out of it? You know?
That's a hard question to answer. I think myself and people like me can certainly offer hope to individuals that are in treatment.
But you gotta want to have hope, right? You just can't say, like you said earlier, you didn't wake up one day and say, that's it.
Correct. You don't wake up one day and say, I want to be addicted to drugs. But you also, and you don't intuitively know how to become addicted to drugs. How do you get addicted to drugs?
Right.
Somebody shows you, right? Somebody introduces you. Well, the same thing applies to recovery, where you can't wake up in the morning and intuitively understand how to recover. You need somebody to show you how to recover. When I came into recovery, I didn't know how to love myself. I didn't love myself. People around me, people with lived experience, loved me until I could learn how to love myself. They taught me how to have hope. They taught me how to take the next step, one step at a time, one day at a time, to get into recovery and to succeed and sustain that recovery. So in that sense, I suppose I do offer some help, some guidance, and some hope to individuals who are currently in treatment. So
from when you went into treatment until you really figured it out, what are we looking at as a time frame? I mean, I know you're still figuring it out. No, you're still figuring it out. But you know what I'm saying? When you went into treatment, you said, this is it. I'm going to do this because I want to be a productive individual.
It takes years, right? It takes years of dedicated hard work, years to get out of the financial debt that I was in, to sort out some of the legal issues that I had, to restore relationships with my family. It takes a long time, but I'll tell you this. It is 1,000,000 times better. My worst day in recovery is 1,000,000 times better than my best day in active addiction.
Exactly. So folks, this is Recovery TV. I'm your host, John Tassoni, a voice of hope. And my guest just proved it. And we'll be right back. after this.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
With these,
and this,
with my mouth shut,
and my ears wide open,
it means that from the moment you walk into the room,
you're the most important patient to me.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You can make it through this. You can get back on track.
Welcome back to Recovery TV. I'm your host, John Tassoni, the voice of hope. My guest today, Jonathan Goyer, has lived it, dreamed it, is now in long-term recovery of over 8 years. Jonathan, welcome back, and thank you for joining us
Thanks
today.
for having me.
So you indicated to me that you're in long-term recovery. So what are you doing now?
So nowadays I'm very involved with the Governor's Overdose Task Force. My full-time job is I'm the program director of the initiative called the Recovery Friendly Workplace Initiative, which is based out of the Governor's office and was born out of the Governor's Overdose Task Force. And what this initiative does is it really brings business owners, managers, employers to the table to help them to identify what their role is in this overdose epidemic that we're facing. Everybody's got a role, right? So what is the role of commerce in this? What is the role of businesses? When businesses engage with our initiative, we give them the tools, the support, training, guidance to become recovery-friendly workplaces. They get designated by the governor as such, and recovery-friendly workplaces really foster a safe and recovery-friendly environment for employees to thrive in recovery. Also gives really resources to any employees who are impacted by addiction, right? Whether it's the family members or coworkers. So really working one-on-one with them. So if any employer is interested in learning more about what they can do to help bring solutions to the overdose epidemic and increase access to recovery, you can check us out at recoveryfriendlyri.com.
Is there a phone that they can call, Jonathan?
Nope, just a website.
Just a website.
We like it that way.
So any business that's out there that wants to join Jonathan's group, as we did here at the Substance Use Mental Health Leadership Council, give Jonathan an email. He'll get back to you. He will send you the paperwork, have a class for your organization, talk to you about what's needed to become a workplace-friendly place. And then also, you get a framed letter from the governor.
You do get that.
Saying that you are a recovery-friendly workplace.
Yep, and any employer of any size can
Yeah, from one to
participate
whatever.
for free of charge, and it really works towards what their recovery-friendly goals are, right?
And
We
that's-
don't push anybody to do anything they don't want to do. We just kind of meet with you and say, what impact would you like to have on your
All
community?
right. Great.
So-
Jonathan, thank you for joining us
Yeah.
today. You've been watching, you've been listening to Recovery TV. I'm your host, John Tassoni, the voice of hope. We'll see you next week.
When people find out that I've been sober for a while, they say, oh, you must have great willpower. The truth is I have no willpower. And that's why I decided to get help. You know, it must take a lot of strength to stay sober. No, it takes strength to ask for help. And once you're done, once you've decided that you don't want to live like this anymore, the real strength and the real courage comes when you ask for help. And then you'll find that people are willing to give that help. And that's when your life can really begin.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231. Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
When it comes to home improvement, you just don't know who to turn to, especially when it comes to a painter or contractor. Years ago, I found a company I could trust, Lopco Contracting. Lopco has been painting and repairing homes in southern New England for almost as long as I brought the news into those homes. From replacing doors and windows to fixing leaks and rotted wood. For a contractor you can trust, call Lopco now, 1-800-PAINTING, or log on to LOP as in professional, cocontracting.com for the personable, particular professionals. Salud.
Sunday mornings, join host John J. Tassoni Jr. for Recovery TV, the voice of hope for addiction and mental health issues. Tune in, tell others. Sunday mornings, 11:30 on CW Providence and 9:30 on MyRI TV. Brought to you by AdCare.